Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton. And today I have the great honor to interview a very good friend of mine and dear colleague, Dr. Beth Forgosh, and we'll be discussing how to address and why to address infant alignment after birth strain. Dr. Beth Forgosh has over 600 hours of postgraduate coursework and testing and is a distinguished certified Craniopath and instructor through the Sacro Occipital Research Society International. She's additionally certified as a Pediatric and Pregnancy Chiropractor, which is where I met her actually, having completed 200 plus hours of postgraduate training and testing through the International Chiropractic Pediatric Association. She is certified in Webster technique and has over 22 years of experience helping to optimize the mechanics and neurology of a woman's pelvis during pregnancy for healthy fetal positioning. She's also a proud graduate of the Advanced Clinical Training Program for Mastery in Nutrition Response Testing, which utilizes whole food nutrition and adds a powerful dimension for health and healing for those seeking exceptional health and vitality. She's an amazing person, an amazing practitioner. And if you want to learn more about her in-person or virtual practice, check out her website at wellwithinsoho.com. Well, I am so excited today to welcome my very good friend and colleague, Dr. Beth Forgosh, to the show. Welcome, Beth.
Thank you, Laura.
So, Beth has an amazing practice in Soho, Manhattan, and she sees the whole family and does a lot of other cool virtual wellness services as well. But Beth was my preconception doctor and prenatal doctor and supported me that entire phase of my life with chiropractic and nutrition services. And I'm just very grateful for that because I know that was a big part of the success of my healthy pregnancy and empowered birth experience.
Beautiful. Beautiful. It was an incredible time. It's hard to believe that it was so long ago.
I know.
Yeah.
Yeah. Over 4 years now. And so anyways, I just wanted to shout out about that. But today's focus, we're going to address, talk about infant alignment, specifically after birth, if there's strains or trauma that occurred, how that can impact the function of that baby. And you and I both see a lot of that in our practice as hands-on body workers. So let's talk about it. Let's talk about kind of how either in utero positioning or the birth process can impact the alignment of a baby.
Sure. So is the idea just to discuss how it is that the position of the baby can influence their alignment? Yeah. So the idea is that if a baby is growing inside of a system that is aligned well, it permits the baby to grow without any mechanical obstruction. So if the mom is getting adjusted during pregnancy, that means that her tissues and essentially her bones, the mechanics of her body are optimized in a way that frees up the physical space for that baby to grow and to develop without any interference from the surrounding tissues or some type of a distortion that might otherwise cause a strain on that baby in the process of developing. And it just comes to mind, there's a baby, it was actually, I still see this child who's now 11, but when he was an infant, he came to me with the plagiocephaly that was really significant. It was...
he had a flat head.
He had a flat head. And it was like, if this kid's head was a soccer ball, like it's as though somebody took a foot and just smashed 1/4 of the soccer ball down into, it was a significant, obvious asymmetry, imbalance. You could just look at this little guy's head, and it was severely affected. And the medical community recognized that this head shape came out that way because it was jammed and locked in this mother's pelvis for the duration of the pregnancy.
Oh, wow. So this didn't even develop the first few months of life. This was at birth.
This came at birth, and it was really resistant. Like you've seen, I'm sure, Laura, in your practice, working with head shapes and baby. And some of them, I'm sure you know as a practitioner, have that quality of being just gentler to manage. It just doesn't take too much, and you can unhook the system in a way that's just doesn't require a whole lot, and it responds quickly.
Yes.
And this was a case of something that was just deformed at birth, that was extremely resistant, that took quite a bit of work.
Yeah.
And
I've had a couple cases like that. They're challenging.
Yes. And the mom was actually really persistent in this case because it's one of those cases where she looked at me and was like, you're going to work this out. You are going to, I say that playfully. It was like she sensed that there was room for this to actually make a change. And she was really determined to provide as much sort of like of an opportunity as possible. So we worked with this particular baby's head shape over really 3 months. This one took to really, and pretty intensively. It was,
and she didn't give up.
She did not give up. And it really taught me a lot because by the end of those 3 months, and even now I see him, he's 11 and there's literally no residual of any kind. I mean, his head shape balanced out entirely. But the doctors were saying we're concerned about, brain injury for him, concerned about brain development for him. They really had suggested a helmet at the time, but it links back to the point that it all came from the fact that his head was asynclitic. It was just cocked off to the side and it was jammed and growing against her pelvis in a way that created that really deformity was what it was when he
and the mom did not get chiropractic care during the pregnancy.
Correct. She just came to me after with the that's how we discovered each other, was through this baby.
Right. And we don't know, maybe like her pelvic alignment, if she had back pain during the pregnancy or any traumas, something that created that baby's head shape, right?
Yeah, she did have a history of musculoskeletal issues that she just was not aware that chiropractic would be able to support her with. Yeah.
Right. So sometimes we see babies. I have had a couple born like that. And then the majority of the cases I see where we start to see a misshapen head, and then, babies are referred out typically in allopathic medicine for the helmet, or they have a nicer word for it now, but the hard plastic shell on the infant's head. Sometimes it's developed like the first 1, 2, 3 months of life, right?
Oh, for sure.
And that, once again, it can be either possibly from some in utero positioning, but more so I find from the birth, right? So can you talk a little bit about how different types of birth can also impact head shape as well as the spinal alignment?
Yeah, it's true. And I think just before I forget the thought on that, I think sometimes when we start to see them developing, part of it has to do with baby positioning. And so I think just the back laying without any alteration in position can, it can be one of the roots of where we see a misshapen head develop. But other than that, when it comes to the birth process itself, certainly a prolonged labor where there is just a challenge in actually progressing the head through the stages of birth. Anything that gets obstructed along that path can create a challenge to the cranial system that just doesn't have an easy time sorting itself. It's just an impact of just kind of greater duration or ongoing stress as part of the birth process can be one of the factors that would kind of make it more apparent as time goes by that this is just not quite working itself out. There's just something as this baby's body is developing that we're starting to notice that the head's not catching up all the way, and that can have its roots in a prolonged labor type of a
and not only prolonged, but I also find like induced. So like when Pitocin, for example, is used, we can have up to 50 times stronger contractions. So that uterus, that muscle is just squeezing that baby at a level that a normal labor contraction isn't creating. And that can be very straining on the entire body, right? So we're not even just talking head and neck now, but if we think about the entire body being squeezed like that, then, you and I both practice SOT, Sacro Occipital technique. We would see a baby with dural tension that would be created from those intense, artificial type contractions.
Yeah, exactly true. Exactly true. Yeah, super valid and valuable.
Can you talk a little bit about what dural tension looks like in an infant, like what some of those symptoms are, so a parent could recognize that this is dural tension?
So dural tension can show up anything from we see it often in the heels, the ankles. So if there's just a flexibility issue with the feet and the ankles, a lot of times dural tension is reflected as heel tension, so excessive heel tension. But also
even in a baby, right, who's not weight bearing yet.
Correct. Even in a baby not weight bearing. But in addition to that, I see dural tension in and around issues with digestive stress. And that can have a meaningful root in the way that the dural tissues are, let's just say, organized. And when we say dural tissues, the dura is the connective tissue, just for listeners, I know you know this, Laura, but it's the connective tissue, of course, that surrounds the brain, surrounds the spinal cord, anchors into the sacrum. And that connective tissue can get, let's just say for simplicity's sake, just warped. And if that tissue is warped, it can have an impact on the central nervous system and specifically on even the cranial nerves, sort of like contained within that dural tissue. So in particular, we talk about and look a lot to the vagus nerve and its path in terms of regulating digestion. And oftentimes we'll see that a baby's struggling with reflux and those types of things, and gas, exactly, and those types of things, with just purely the constraint of that vagus nerve as it exits the hole, and not like a normal hole. It's basically the nerves are meant to pass through the cranial system into the neck and down and through the body. So if we see cranial strain at the level of the dura compressing the vagus nerve as it's trying to exit its own nerve root, that is an area that would show up as a digestive symptom in particular.
Yeah. And I see a lot of that in my office, and I find that it's actually quite common.
Yes.
But this is something that pediatricians aren't trained to check for. So that's, what we see is unless the birth trauma is severe, like a broken clavicle or something like that, if that baby is out and they're alive, then, the doctors are done, right?
Correct.
The baby's
Exactly.
still breathing. And they're like, okay, they're not in NICU, so we're successful here. But there's some subtle things going on that can be straining that baby days, weeks, months after that birth.
Yes.
That aren't being diagnosed or picked up by the pediatricians. And that's what you and I are checking for as pediatric chiropractors.
Yeah. And exactly. And that also can show up, as a symptom of digestive stress. It can show up as, when it comes to breastfeeding, if there's a preference for that baby to latch on one side but not the other. Sometimes just the ability for that baby to turn their head comfortably comes from a strain within the dural system. And then even if the baby's overall posturing just favors one position, so if there's an arm hiked up high on one side and a knee hiked up high on one side, and that just tends to be the go-to posturing, where if there's just not the ability for that system to be at ease and to organize itself in a relaxed way, that's another sign that there could be some issues just with, again, a warping within the dural system.
Big time. So these are the babies that are always wanting to kind of stay in that fetal position. fisted, shoulders, arms in, knees bent in, like you mentioned. When they're laying on their back, they're not open. The anterior front of their body isn't just relaxed and open. They're always kind of pulled in. And they tend to be a little more irritable. They're not at ease, right? Physically or emotionally. And it's an indication that their nervous system is being stressed, right? So this is something that we can gently help support the baby through this hands-on care. It's very light force and it's very powerful. I had one parent recently, I was like, this is, we were talking, it was a first visit, and I'm like, I'm going to be checking your baby's tailbone and spine, and then I'll be doing some work on their head. And it was like, oh, is that safe? Right? Yeah. Especially the head part. They weren't so worried about the spine because I'm a chiropractor, right? So I should know what I'm doing. But I'm also a craniopath, right? There's not, as you are as well. And there's not a lot of us doing this work, but it's so powerful because we can actually adjust the skull. There's no popping or cracking, but we are moving the bones along the sutures, which are the joints of the skull. And we're optimizing the alignment of those bones, which will optimize brain development, brain function, and like you mentioned, the cranial nerve function as well.
Yeah.
Did you know that there's an organizing app designed just for families? If you're starting to feel busy again, and I know I am, and your calendar is jam-packed with events and kids' activities, why not do yourself a favor and get Cozy? Cozy is the #1 organizing app that families use to juggle school schedules, practices, meetings, doctor's appointments, and even a workout or date night. With Cozy, you'll be all set up to know everyone's schedule, who's doing what, when, and where. And Cozy will even send emails every morning with the day's agenda. No more missed pickups or double bookings. Here's how it works. Cozy tracks everyone's schedules and events in one place with a shared, color-coded calendar. Cozy even reminds others about events so you don't have to. It's easy to get started. You can pull in events from your family's personal work and school calendars. And the best part, it's free. Just download Cozy Family Organizer from the App Store. That's COZI to get the free app today. I know I've been using it and I absolutely love it.
That's exactly right. Yeah, there's just, I think one of the let's say all of chiropractic is underutilized for the purpose of pregnancy and birth. It's just such an overlooked opportunity that has so much power to it and it can't be overstated. And the subset of that is the cranial work, which, at the point, because it doesn't come standard as part of the chiropractic education, it's not something that all chiropractors have training in or familiar with. But for those of us that it piqued our interest and we pursued that aspect of, of the biomechanics of the body, it's like we cannot unsee it, that the ability to work within the cranial system, again, like you said, it's so subtle. It's not anything that would, by the sight of it, cause any type of alarm or concern for anyone watching. It really is a gentle approach. But when you know what you're doing and you know the structures that you're working with and you know what needs to be done to target, it can have a profound effect at unhooking issues within the brain, certainly, but also the connections to the rest of the spine. So it's I don't want to say it's an adjunct. It's just just a beautiful way to approach to make sure that we're catching all of the areas that may be strained and may be primary in that little being's pattern.
Yeah. And, for me, my pull to get this additional training as a craniopath was because I was seeing a lot of misshapen baby heads in my practice. And I felt like even if I only worked on their spine, right, I was going to make some positive changes to that head because the baby would be more mobile. They would be not favoring that torticollis one side, and therefore they would have less pressure on that one side. And that would alone make some changes, I think even up into the dura. But it was like a limitation, right? It was like I could make subtle changes, but I wanted to be more profound and really make a difference in how this head alignment was coming together. And that's why I became a craniopath. I do this work on adults as well, because anybody with a skull can benefit from craniopathy. But it was those infant heads that just kept me up at night. And the other thing with an infant head, a lot of them, they don't have a lot of hair, right? So we can really see what's going on. And their skulls are so mobile because they're meant to move during going through the birth canal. Like, this is by design. And then as we grow, sutures start fusing, and we have complete fusion around the age of 80. So even adults do have some mobility in their skull, but obviously much less than an infant or a young child. So to me, that's the window, right? When we can make the most powerful change is that time. And, I don't know if you want to go into addressing a little bit about the helmets versus hands-on work for addressing cranial misalignment?
Good question. I think that I would say at one time in practice, let's just say I was like extremely alarmed with the idea of any child having an intervention, a helmet type of intervention. I still see that if someone's in a location where there's a Craniopath that's capable of actually getting to work and supporting the system, that there is no better way to approach helping to normalize the head shape and to address the plagiocephaly. And I do think that the issues that are being missed with the helmets are meaningful, meaning the reason why the chiropractic approach, when done right, I see as being the best direction, is because if you're simply working with the superficial shaping, what can be missed is the underlying dysfunction that still remains once the head shape is stable, let's just say.
Right.
And
it's much more than just aesthetics.
It's much more than just aesthetics. But with that said, I'm feeling sensitive only because I also recognize that not everybody has access to a practitioner that can, let's just say get the job done with the crane, so I'm sensitive to just also wanting to, I guess, also recognize that if all that's available is the helmet, by and large, there's a lot that can be done after the fact to catch up with where just the cosmetic was addressed. I don't know if you have concerns about this, Laura, but I have not an overwhelming concern about those helmets causing serious damage. I just find them to be incomplete. So
right.
I'm not sure how you see it.
Yeah. And I completely agree with you. Not everyone has access to a craniopath or even a craniosacral therapist. Right. And I have had severe cases in my practice that I just felt like needed to be co-treated with a helmet. So even though they're coming to me, I still felt like it would be beneficial to have that. And what we found in those cases is those babies did have to get checked by the cranial technologies more often because we were making shifts and changes that were faster than the helmet alone. But I just felt like, we needed more support, right? It was like very severe cases. And then I had one case that was a craniosynostosis, which was a surgical case. The baby had early fusion of their sutures, which then obviously impacts brain growth and development. And the only way to correct that is a neurosurgeon opening up those sutures so the brain can expand normally.
100%. Yeah.
Yeah.
There's just literally nothing that can be done conservatively with that type of a limitation.
Right.
Yeah.
Thank God it's rare, but these cases do exist. So yeah, we talked about like some of the symptoms. We talked about those babies that were really tight and tense. They had, misshapen heads. Maybe they favored looking one direction, the digestive issue. And then we touched a little bit on breastfeeding. Do you want to talk a little bit more about breastfeeding, alignment of the TMJ, the tight mouth,
Yeah, sure.
Or tissues, anything like that that's related also to cranial alignment in the birth?
Yeah. So I do see quite a bit of just latching issues and breastfeeding issues. And it's all of that. It's that, just the idea of favoring one side versus the other. And one of the elements that we see commonly in being able to support a successful latch is the ability for the TMJ, for the mouth to be able to open wide enough to be able to manage an appropriate latch. And again, one of the gems within the cranial work is the ability to assess the jaw for proper movement and full capacity. And it's such a, to me, it's like almost, it's just so simple. It's as I'm speaking about it, it's like, oh gosh, that's kind of profound that we can actually unlock where there's an actual mechanical restriction around being able to open wide enough to support an optimal latch. But it really is just as simple as that. It's really just evaluating to see what needs to be done in order to unlock where the jaw is constrained, and to permit breastfeeding to go, to be successful from there. I will say that sometimes when it comes to even the jaw, we're spending a lot of time really valuing the cranial education around these types of alignment issues. But the truth is, there's a lot that connects, it's like, what is that old song? Like the knee bone connects to the thigh bone and the thigh bone connects to the, whatever, to the hip bone. And it's like, obviously the whole body is connected head to toe. So really the truth is when we're evaluating, even for latching issues and breastfeeding issues, we're looking, yes, at the cranial system, and we're also considering the mechanics of the whole spine and musculoskeletal system. So, at times it's really a neck issue that's causing the jaw constraint. At times it's even a sacral issue that's causing the jaw constraint. So it's having I guess if from we're going deep into just practitioner, I think, minutia. But for somebody who might be listening, who has a baby that they're concerned about is not feeding optimally, the truth is that there are structural issues that a trained practitioner can locate to help support just the freeing up of certain areas. Because sometimes you'll have a lock at the TMJ joint itself. Sometimes it's muscular, and that reasons for muscular constraint can come from, areas, broadly beyond the jaw itself. So yeah, that's what comes to mind when I think about lactation issues. But
and the fascial component too, right? Which isn't technically muscular, but it is a soft tissue constraint and in that tight mouth, right?
Yeah. I mean, even the diaphragm can cause issues with the jaw being tight, and the pelvic floor can cause issues with the jaw being tight.
The hip flexors.
The hip flexors can cause issues. A collarbone that's just not lined up properly can cause issues. The shoulders, definitely. And the shoulders. So there's again, it's each case is so unique, and it's sort of the beauty of it. The beauty of being in practice is being able to step back and really locate what's going on with this system, and to do what's needed to correct it. Yeah.
Yeah, exactly. It's not like every breastfeeding baby has the same issue. And then also with breastfeeding, it's a dyad, right? So you got to look at what's going on with mom as well. So I know in your practice, you also do take care of a lot of the moms and see the new moms and babies together, and, getting new moms adjusted, help with the milk supply, their comfort with, breastfeeding posture. So all of these things, are good to support a more successful breastfeeding relationship.
That's exactly right. Yes. And that's true. That's a really good point, that when it comes to lactation issues, the source oftentimes comes from the mom and can be supported quite well and monitored successfully with nutritional protocols. Everything from, is there an optimal food to eat to support? Is there a certain supplemental support? Finding out where the breakdown in the supply is coming from. Sometimes it's hormonally based. So it's really doing a deep dive to see, just, is the issue coming from the baby? Is it coming from the mom? Is it a nutritional issue? Is it a structural issue? And to be able to, provide to support where the breakdown is.
Exactly. Similar, it just reminds me, similar to like fertility, like if there's issues with getting pregnant, people in general, look at the woman, right?
Yeah.
And recognizing that it takes two. So the same thing with breastfeeding, it takes two. And if there's a challenge, we have to look at the whole party.
Correct.
The whole dyad. So, yeah. So, I mean, I know we covered a lot, like kind of what causes some of the birth strains. We talked about some of the symptoms, the corrections we do hands-on. We talked about that. Is there any other things you wanted to add around this?
I think I did I guess we could talk just to some degree, just the value of chiropractic and supporting the mom for the sake of permitting a healthy birth. And if a mom is looking for a vaginal delivery and has that preference, just kind of supporting a mom in that, you start to wonder, is it really necessary to have a natural birth? Is it desirable to have a natural birth? I mean, all of these questions are out there because the culture has so many different ways of approaching it. And there's, I think I did want to mention just the value to the baby of having a natural delivery when possible really does permit for optimal brain and nervous system development, that there is a reality to passing through the birth canal that creates the pressure dynamic, just appropriately applied, does actually that compression, expansion of the cranium upon delivery helps to stimulate the brain and the nervous system to initiate the developmental process. So it's just another, I think, I wanted to take the opportunity just to recognize the value of
a vaginal delivery.
A vaginal delivery for that purpose. We start to kind of lose our way when we look at C-section babies do seem to have a head shape that just is unscathed. And you could almost question whether or not there's any benefit to going through the birth canal when it seems to be a bit of a difficult process. But the truth is that if the baby is born by C-section, there's a little more that needs to be done in order to encourage just the developmental processes that have been missed as a result of not having that compression expansion influence into the nervous system to really create these, there's a purpose to all of it. And just to not bypass the fact that, to recognize where the benefits are coming from when it comes to natural delivery. It's conceptually, it sort of just makes sense, philosophically, well, this is designed to do that. There must be some
right. Our bodies were designed to birth through
right.
vagina. Yeah.
Yeah. And not to be dismissive if someone needs to get a C-section. Well, certainly, but I know like in Brazil, I think 50% C-section rate is due to just seems easier that, there's no recognition that maybe there is some benefit that's being missed by having a vaginal delivery. So where possible, there's specifically that benefit to the developmental process.
I'm really glad you mentioned that because like you said, there are, true needs for emergency C-sections. And that's not what we're just talking about. We're talking about, where a woman can prepare during her pregnancy to increase her chances of a vaginal delivery. And there are lots of things to do, chiropractic adjustments, working out, being strong, fit, and having a mindset of that you're safe and not afraid of the birth, right? And that you can open and surrender, and then you have your birth team to support you. You're going to set yourself up high for a likelihood of a vaginal delivery. But even beyond the vaginal delivery, and this might be a little controversial, but I also really believe that unmedicated vaginal delivery is also, when possible, optimal. Because we talked a little bit earlier, when there's inductions, there's Pitocin, other medications, IV antibiotics, these things all will impact that baby and in a negative way, right? And they're very common in birth. So I think that they've become kind of just like accepted as the norm, but they're not normal. And I'm not saying that sometimes those interventions aren't also needed and can help create a vaginal delivery, right?
Yeah.
But we can look to see how should be like more of a last resort as opposed to a first resort, including an epidural, by the way.
Yeah. And to your point, as all of those things may have their place and may be necessary for all of those reasons towards encouraging, let's say, a labor that's having some difficulty. And now these things are needed in order to encourage just the, optimal result for the difficulties, that are occurring during that delivery. However, I think, the original idea is that if women actually recognize that there's an opportunity to go to the chiropractor before, as part of the process, everything from getting a birth, I forget what you're referring to it as. It's not just the prenatal, it's even before that, like the preconception element, and just calls more attention to the value of looking further ahead, that the birth process, let's just say, starts at preconception. And then, there's the prenatal work that can be done, meaning there are many steps along the way that can contribute to being able to just experience birth and the birth process, as its natural process. Again, I'm stumbling around words, but it's just that idea that there's a lot that can be done. And so for a mom to get adjusted as a course of the process, getting prepared for labor and delivery can't be overvalued. And also, I think it could be worth I think someone might not even know, are they having alignment issues? If somebody is actually, what would be a cue or a clue to somebody that their alignment might not be functioning optimally? How would somebody have some sense that they could benefit uniquely and particularly from chiropractic as they're going along in their pregnancy? And I think to that, it's just recognizing that difficulty with any type of movement, whether it's sitting, whether it's standing, whether it's, laying down and then just in the lying position, if they're having trouble with movement, that's just one clue that something within that frame is just not working within its normal movement. And certainly tension, pain anywhere in the body would be another cue. So I'm sure you've seen a lot of people with pubic symphysis dysfunction, and those are unique to pregnancy, but just tension and pain in the back and anywhere in the body is going to be a clue that there's just something off here that makes sense to address, partially to support the mom and relieve any issues with her own body, but that also is letting you know that you're not alone, that baby's being impacted as well.
I'm so excited to share with you a company I recently discovered called Kindred Bravely that came into life in 2015 by Deanne Ackerson and Mama 2 when she couldn't find any comfortable or functional pajamas while nursing her second son. She decided to design her own, and this led to one of the best-selling pajama sets, the Davy Nursing and Maternity Pajama. As moms, we have to stick together, which is where Kindred comes from. And Bravely, being a mom can be super tough. It's not for the faint of heart. It takes a lot of courage, and that's where the name came from. At Kindred Bravely, they are devoted to making life easier for pregnant and nursing moms. From breast pads and non-skid socks to nursing bras and pajamas, Deanne creates every piece with comfort, beauty, and function in mind. And her designs have been recognized by multiple awards. Perhaps more important than her clothing is Deanne's mission to build a community of moms who support and celebrate each other. Go check out her website at kindredbravely.com and use the promo code WELLADJUSTED20 to save 20% off your purchase. Yeah. And so, for example, like we're both Webster certified. And so a breech position baby is typically because mom's pelvis is out of alignment. So, or even a baby who's transverse or just really not in the non-optimal position is typically connected to mom's alignment. So when mom's getting adjusted, especially that third trimester, we're not only helping that baby go head down vertex and like a basketball hoop lined up with the hoop. The pelvis is the birth canal, is the hoop, and everything will pass through much easier if it's lined up. And that's literally just with mom getting her pelvis and spine adjusted.
Correct. Exactly. Yeah.
Yeah.
So, yeah.
Which is also why women getting adjusted during pregnancy are going to have, in my opinion, a higher likelihood of a vaginal delivery and even an unmedicated vaginal delivery, because it's easier and more efficient.
Correct. Exactly. That's exactly right. Yeah. So I see it that way as well. And
what about babies that are stuck in a breech position for weeks at the end of the pregnancy? I mean, what does that baby look like once they're born? Let's say maybe they never turn and they've been breeched for like several weeks. Now they've been delivered via C-section, a scheduled C-section. What kind of alignment patterns do you see with that infant?
let's see. So I don't know that I've looked at that as being a pattern, but let me see if anything comes to mind.
Like tight hips,
Well,
dural tension.
yeah, I can't say that I've spent I haven't put it together as being a certain pattern that I see developing as a part of C-section post-breech delivery. But
specifically if they were breech, right?
Yeah.
I've seen a few cases like that. And these are the babies that are wanting to keep their knees up and really keep in that flexed position, which is also related to dural tension, but it's like tight hip flexors and tight hip joints that need to get like kind of unwound to
that makes
create
sense.
ease in the lower part of their body.
Yeah, I can see that. And I can see how that makes sense as well. Just the constraint associated with the breech positioning has that kind of, quality to it. It's just, that's not typically a relaxed intrauterine condition.
Correct. And then what about multiples? Like if there's 2, 3 babes squeezing in that uterus, man. I mean, you've probably seen alignment issues with those babies as well, right?
I have seen alignment issues with those babies. I the truth is, I see alignment issues with most babies, with the exception of one that really kind of did take my breath away. And
I remember this case.
It was just
years ago.
It was so surreal, only because it's sort of like, it's almost like, I don't know how to call it. Like, it's like, it was just one of these cases where it was just the optimal birth for the mom. So it blew my mind because she had a home birth. It was a natural birth. And it amazed me. She described it. I said, oh gosh, like, how did you hold up? It just, to me, sounded like, I'm sure she went through some hard times in the process. And she just like, no, she said, I didn't experience it as pain at all. She said, I just literally just like surrendered to the force of the universe. And I just experienced nothing but just surrender as this body just took care and brought this baby through me. And it was I mean, it's a great, in theory. I think conceptually we all have this vision of maybe being the person that is this exquisitely connected to the universe at the time of birth. And certainly I think that would be an ideal that anyone would have, but she did it. And I just looked at this woman, and she said, and he came out, she's like, he never cried. He just like transitioned in a way that was, just the way that she described it. And then so she brought him in because it just made sense to her to at least check. And I just didn't know what to expect one way or the other. And
right. You did a wellness checkup.
Yeah. And I just was really intrigued because I actually did not see that there was anything that was needed to correct in this baby. And it's almost like the fairy tale story that, demonstrated to me in real time that there's some truth to just the, to this idea of an optimal birth where all of that comes together. And she just, said it was the most exquisite thing. And it's like she didn't experience it as pain, was what she said. And I think for some reason, she just is not particularly pain sensitive, meaning she just doesn't, she's not somebody who has a high or like a low pain tolerance. She's got a high pain tolerance, in general. But I think in addition to that, she did have that connection that just gave her the experience of surrender at that level. And
So,
yeah.
It's so powerful. I had a somewhat similar experience where I just felt very surrendered and everything was quick with my birth, right?
Uh-huh.
And efficient. My
Yeah.
pelvis was lined up, my baby was lined up, and I didn't have to really think about, I mean, I did push him out but it was 2 pushes. But before that, he was already pushing himself towards that. Like, you know what I mean? And there wasn't any conscious pushing on my part.
Wow.
But my uterus was doing its thing. He was doing his thing,
Wow.
moving down. And it was really pretty amazing because, if you watch movies, you think like this woman's like, and even stories I hear, I'm sure you hear a lot of birth stories too. This woman's like, I would push for 3 hours. I'm like, what?
Yeah.
Oh my God, it sounds like so horrible. So, I mean, this is a real thing. I mean, this does happen, but it doesn't have to.
Yeah.
I want more and more women to hear these positive birth stories
Yeah.
so that they know that they're possible.
Yes.
Like you said, it sounds like a fairy tale, but this was a real life experience.
Yeah, it was
that
a
this
real life
woman had.
experience. It was a real life experience. That is true.
Yeah.
Yeah.
And my hope and prayer is that more and more women can also have that experience as well.
Yeah, that's right. I know. And it's, the resources are being underutilized. And that's the one thing that both of us, it's just, it becomes so palpable and apparent just to be in the world that we're in when we're just on the ground with hands on and just witnessing the experience. As a chiropractor, I think we all, whether it's through birth or not, it's just that exquisite sensation of recognizing when a system just opens, unlocks, lets go, and frees up its movement, its energy systems. You can feel opening up, and just you can recognize when there's a body that has just accomplished a shift in its overall state of function, and it's so meaningful. I mean, it's just so basic when the system is just optimized, running well, mechanically operating as it's capable of doing. That's the precedent for the rest of the body being able to join in. There are just rhythms that run these bodies. And when the mechanics are freed up and available, all of those rhythms just come together and coordinate. And it's just like, just being a partner with life, and it really is so inspiring. And I think for those of us who practice and really connect with that, it's just, it's almost like baffling that the culture isn't built on the utilization of that type of opportunity.
Right. It's so underutilized. Yeah. So, I mean, definitely one of my big missions and passions, through my practice, through this podcast, is just to get the word out. So more and more women are hearing. I have to say what I've noticed is I have more, and I don't know if you've seen this, but I've had just in the past few years, a handful of women that are hearing about getting their babies to a chiropractor. And it's not coming from me, right? Like they're not just getting referred directly into my office. They're hearing they need to get their baby checked after birth. And they're Googling, looking for a pediatric chiropractor in their community. And that has just been really a recent phenomenon that I've noticed, but I love it that it doesn't have to just come from me or like the LC that refers to my practice all the time. Some of those partners that are going to send people my way, these women are like, I know I need to bring my baby to a pediatric chiropractor. Now let me find someone who's qualified to do this work, right? And so there is a shift that's occurring, which I'm so excited. And I think now, at least in my community, enough women have brought their babies in. They're telling other moms, right? That's powerful. Moms tell other moms.
Yeah, that is what I see more than anything is just a Facebook group and somebody comes in from having been on, a Facebook group. And
yes.
Yeah.
Totally.
Yeah.
Those moms groups are great.
Yeah.
So in closing, I just wanted you to share a little bit about some of the virtual services that have been born with the COVID pandemic and kind of what you offer for healing.
Yeah, sure. So I do have my active chiropractic practice here in Manhattan and Soho. And I also developed in COVID just almost like, I don't know, it's like unexpected, but I developed a virtual practice predicated on my nutritional work. And it has since developed into more of a wellness model. And it is capable of identifying where a person, whether it's a mom, just any person, a mom, a baby, a family, where anybody is having some type of a health challenge that they just can't get on top of. And so we're able to screen from a distance to be able to identify and locate where the system is in suboptimal condition, and then to determine what the correct solution is. And sometimes that solution is nutritional in nature. Sometimes it has to do with some type of a healing practice, or some maybe chiropractic is the solution in some cases. But it's essentially running programs for people to optimize both their health and also their well-being. And it's doing it in a way that has some structure to it. So it's locating where the system needs support, and then it's identifying what resources on the planet are best suited to making the most meaningful difference towards correcting those imbalances. So I'm not sure if that explains it exactly, but it puts together for somebody, essentially clears up any confusion about kind of like what foods agree with me, what lifestyle agrees with me, what practices serve me best. So if somebody's kind of inspired stumbling around the internet, like looking at, red light therapy or sauna therapy or different types of spiritual practices, and starts to wonder like what actually is suited for me, what's actually going to serve me, it's able to sort out just answers to questions that someone might have about how to create and utilize resources to optimize, number one, health, and I guess, well, I shouldn't even say number one, but one and two side by side, health, and also a person's well-being. And I find it to be just really beautiful stuff. But it can all be done from a distance, and it uses muscle testing as the way to really determine to access information. And
it's powerful, because I think, like what you said, there's so many beautiful healing practices out there and services and modalities, but they're not one size fits all, right? And I think sometimes people can go years and invest thousands of dollars in all these different practitioners and modalities in their search for optimal health. And it's like trial and error, right? And that's certainly better than trying a bunch of different medications, but it's also like not specific to like, what does your body need right now? And I think the other thing is recognizing, what does it need? How much of it does it need? And when is it time for something new, right? So recognizing that as our body is changing, different modalities. And I think even myself, we get a creature of habit. Like, I do this workout every week and this is what I do, but maybe it's time to switch it up and I do a different type of workout or a different type of movement, that's going to be what my body needs now. Even like as women with our menstrual cycle, different types of exercise and foods are better at different times of the month, right, for our health. So this is customized, individualized program for the patients that you work with.
That's exactly right. Yep. Yeah.
Amazing.
It's amazing.
You're such an amazing healer.
Thank you, Laura. And needless to say, so are you. And such an inspiration. It's just, to me, you just, you're just so just full, vibrant, and strong in every way. And I just enjoy, admire, and just enjoy you.
Yeah. Oh, likewise.
Yeah.
Well, thank you so much for coming on the show today. I really appreciated your time.
Yeah, you're welcome.
I hope you enjoyed today's episode with Dr. Beth. She's an amazing resource and very passionate about optimizing neurology and function for everyone from babies through older adults, and really what having health and vitality is all about and how to accomplish that with nutrition and chiropractic. And like I mentioned during the interview, she was my preconception doctor. So this is a topic I'm very passionate about, working with women 3 to 6 months prior to getting pregnant. And if you want to learn more how I can work with you to support you in your preconception journey, check out my website at drlaurabrayton.com under the Brayton Birth Method to learn how we can work together online and I can help support you in having a healthy pregnancy and an empowered birth experience.